Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Walked my regular 10,000 steps, and then I was working at a church bazaar and just overstressed it, and I was wearing my cute tennis shoes, not my good and stable ones. So.
Okay. And you start feeling pain there. How much pain from 0 to 10? 10 is emergency room.
When I first heard it, like an 8.
Okay.
And then it stayed about 7, 8. Now it's consistently a 2, 3, but it gets
2, 3. Okay.
early. It gets heavier in the mornings, or at night it's like a 7.
Okay,
8.
so you have a constant pain, 2 or 3, and your pain increase in the morning or at night, or if we can stimulate it. Okay. So have you had any treatment for this last 4 or 5 months?
Nothing.
Okay. So we're gonna do the motion that aggravated.
Okay.
And let me know how much pain from 0 to 10.
Yeah, that's like a 3, 4.
Okay, let's do 10.
Other side.
Okay. Suck your stomach in, put your hand in your waist.
Just same side?
Yeah, we want to aggravate it, okay?
Oh, yeah.
And if you're not counting, we're going to do 500.
Okay. This is 6.
Okay.
7.
How's your...
8. I feel myself
You
rolling
are
over here,
kind of unstable a little
so
bit,
that
so
I
you need to work on
don't
that.
press on there. This is why, but I need
So
to
I don't want you to
compensate.
I don't want you to compensate. I want to see the correct format and see if that's aggravating your symptoms. How much is now?
Yeah, it's like a 4 or 5.
And you feel it inside. Is that correct?
Inside.
Okay. 4 or 5. But in the morning, your pain is worse than that.
Much worse.
Instead. You feel this knot here? That's a scar tissue. Okay. Definitely, when looking at your foot anatomy, you have a risk factor to have issue here, because one of them is you have a flat foot. The other thing, your tibia bone is here. This bone is look like longer than the other side, and if kind of like you have more like kind of swing here or like curvature than the other side. So after the treatment, I'm gonna work with you to correct your flat foot and try to help you to have a better alignment in your foot, so to decrease your risk of having more compensation on this side. You feel this bump?
Yes.
Okay. That's the scar tissue there. So when you have a scar tissue, the muscle should act like a rubber band. When it contracts and relaxes, it should stretch. So when you have a scar tissue, it's like you have a knot in a rubber band. So you will not have more, you will lose elasticity in a rubber band to not stretch and start to have compensation by pushing on your bone. Can you tell the difference here?
Yes. Oh my gosh.
Feel looser here. Okay, you should feel pressure with the treatment, but we don't want to cause pain.
Okay.
Because if you feel pain, there's a chance you have internal inflammation, so we don't want to inflame it more.
Oh, okay.
Okay, so I'm gonna show you actually the scar tissue here. If you don't have a scar tissue, it should feel like nice and smooth like this. When you have a scar tissue, you're gonna feel like grinding, like the tool over like kind of like sand or rocks or something like that. Bumpy area a little bit here. Okay. So what I'm doing is actually like shaving it, you know. And you will see some redness after the finish where you have the scar tissue.
So then it just dissolves, or it just gets, what happens to it after?
Well, perfect scenario actually it should dissolve by itself. But when we have chronic condition, your body is not resolving it, you know. So we have to manually just break it, you know. Yeah, it should dissolve by itself. That's a perfect scenario. But with chronic musculoskeletal issues, your body is just built scar tissue but has not get rid of it. It's in the way of everything. Especially when you have like anatomy issue,
Right.
like flat foot or
I am
alignment issue.
ticklish, I'm sorry.
That's okay.
Okay.
Just don't kick me, okay?
No, I won't. I'll try not to. Right, so if it's anatomy, then it's more of an issue. I mean,
Well,
you
that's a
can't-
risk factor to really have this. So what we're gonna do is I'm gonna give you exercise to correct your flat foot.
Okay.
Some patient can correct it, other patient cannot. If you cannot correct it, I will give you orthotic to correct it
Okay.
to decrease your risk of having this issue in the future.
Okay.
You want to remove any trigger that causing the issue. That's a risk factor for you, especially for this. You're compensating at the site.
Right. Okay.
That's where your arch collapsing
Right.
inward.
Okay.
So, but I cannot correct your anatomy
Right.
or your flat foot unless we release the tightness, because that scar tissue gonna get it to the bad alignment again.
Okay.
So I like to just clear up everything, and then we'll try to do the function training to correct, work on your gait, work on your flat foot. I personally had flat foot, I corrected with exercises. So
Okay.
most of patients can do that. You hear that a little bit?
Mhm.
Some crunching is normal around the bone, but if it's too grinding, that's usually building a scarring around it.
Okay. Are you hearing?
Yes.
Yes.
Yeah, it's loud. You can hear that,
Mhm.
and with the tools, it give me like a vibration kind
Mhm.
of like feedback.
Mhm.
When it's nice and smooth, I don't feel like something
Mhm.
vibrating. But
Okay.
when it's something like this, it's just a good tactile feedback.
Yes.
So the good news is actually a lot of patients who could be one to two treatment and we just smooth it out.
Mhm.
You know, it depends on the thickness of the scar tissue.
Right.
The constant pain now.
No.
No constant pain.
Mm-mm.
Okay.
Keep going. Okay, now it is hurting a little bit.
How much from 0 to 10?
Yeah, like maybe 2, 3.
Okay. How many did you do so far?
I have to do 500 because I wasn't
Oh.
counting.
Now we're gonna go up to 1,000.
Ah!
Okay, that's okay. I think you did more than 2.
I
No,
think-
you did more than 15. It's actually shin here that's bother you. Okay. So we're gonna do 2 things at the same time.
Yeah, this one.
Okay. So, you know, you come for one leg, you get the other leg. Free with the
Oh my
treatment.
gosh.
Buy one, get one free.
Oh, they come to.
All the information, to mother information, should take a few minutes to really get the information down.
Okay.
So,
Now, you do not sell that with your stuff. You sell the.
this is coming this month.
Oh, seriously.
Yeah,
I'm
well,
very
we had an issue with the manufacturing taking time, but this is a recent, my favorite actually. So because it's very strong.
This is very exciting.
Yeah. So yeah, we have it for professional. This is cover really big area. The range of it is 4.5 inches. Yeah, it's very strong.
Wow.
So usually take like saving 70% of the time. The other one, the Magna Hair Pro, you can wear it. This is, you have to sit and use it sitting because it's heavy, but it takes less time.
Yeah.
You know. So I'm gonna put it here. So you felt it here, yeah? Make sure you're comfortable, okay?
Yeah.
Okay. So I'm not really surprised with having issue in your chin because your leg is kind of not really
Bowed.
caved in, bowed. It's, I saw worse than this, but
Oh.
you have a little bit
That's
more.
good. Yeah.
You know, I have to work on your flat foot and both, but let me just work in here.
Right,
So
'cause
you feel it
both-
around here?
Yeah. Because
Yeah.
both feet are flat, so one
Yes.
will have maybe a different. If this bone, if my tibia is Is that what you said, or my
Yeah, tibia.
Okay. My tibia is longer over here. I might have different issues, but I still might have issues because of being flat-footed anyway, right?
But here is the thing, that doesn't mean you have a leg length discrepancy. A lot of people, they usually have, that's very typical. Your tibia is longer here, but your fibula is shorter.
Okay.
To compensate for the whole.
Wow.
So I will measure it afterward, but
Okay.
I don't want you to worry about it.
Okay.
We'll take care of it, we'll get you a new leg.
So would you say scar tissue is like fibers together? Is it like, what would you?
Great question. So our body has to go through 3 stages in order to heal. Again, I use external paper cut for visualization, but the same process happens with any injury. So the first stage is inflammation. When you have the paper cut, you will get like swelling, redness, the blood start to rush to that area. Okay. Second stage of healing, it's called proliferation stage. That's the stage where your body starts to build the scar tissue, glue those tissue together. Your body, the only glue you have is the fibrosis, which is actually the scar tissue. Fibrosis is a technical term for it. So like some female get like endometrium fibrosis, that's a scar tissue, you know. So so fibrosis, that's a technical term for it. We need to have a scar tissue. It's part of our survival. If actually our body does not build the scar tissue, the wound gonna be open, that's susceptible for infection. The problem is when you have too much scarring. Because technically, the last stage, which is called the maturation stage, that's when your body dissolves everything, clear up. You remember when you get any cut, it just hard in the beginning and then it's nice and smooth after that. That's a perfect scenario. The same thing happened internally. You strain your ankle, you walk in funny, you have a bad anatomy, so you're compensating more there. You get a tear inside, so your body builds a scar tissue, but you still have the bad anatomy. So every day you have a layer of scar tissue. So after a while, you might have 40 layers of scar tissue. So when you touch it, you feel a lump.
Yeah. So is it doing micro tearing and scar tissue micro tearing, like, and it never gets out of that
because
system?
Because we have not removed that trigger. If your trigger is bad anatomy, walking funny, if you don't remove the trigger, it's just a vicious cycle. That's why it's important to release it, break it, correct the trigger. So we break this cycle from both ends. It's like, you know, someone is diabetic and eating carbs every day. Okay, you can take medication, temporarily fix it, but you're still eating the carbs. We're not really getting to the root cause of the problem. But if you remove the trigger, you know, there is a very high chance you really be able to have it under control. You know. And the same process happen anywhere for any musculoskeletal injury. Tennis elbow, shoulder pain, impingement. Our body has one program. It's only one healing cycle: inflammation, proliferation, maturation. In medical field, you know, labels, you know, plantar fasciitis or tennis elbow or shoulder impingement. But that label is actually tell you the location of the problem. But the same thing happened internally. Tennis elbow is inflammation and scarring in the tendon there. You know, you strain your ankle, you start to have inflammation and scarring there. So if we do understand or look at the normal healing cycle, all of these is actually makes sense how to get to the root cause of the problem instead of just stuck, okay, this is tennis elbow. You know. Well, today is the 3rd day is here, but how many treatments you had it for your ankle? This is a follow-up for the ankle.
2.
2 treatment day for the ankle.
Yes.
And just briefly, history about your ankle and how you feel now.
Yeah, so heard it in November 2021. Pain was at least a 7, especially at night or in the morning when I got up. I couldn't barely walk, and I would really just favor or try to walk differently so it wouldn't hurt so badly. It was not healing, even though it would warm up during the day, which caused me to come here. That first day, we got it to about it was about a 7, and then probably left about a 3.
Okay.
Yeah.
And you had just 2 treatments.
Yes.
And did you walk after that to test it to see how you respond to the treatment? How long did you walk? And
yeah, I walked that day. I walked for at least a half an hour with my new posture and my new insoles, heel to toe, and really focused, holding in my gut and doing all the things Dr. Jacob said, and felt stronger. It was fatigued in the evening, and then came back yesterday.
Next day? Okay.
And then it was probably the most out of 3.
Okay. We started with 7.
Yeah,
which
we
is
started
good.
with 7,
Okay.
so 3. And then this morning, actually, when I woke up, I got out of bed. There was no pain.
Beautiful.
Walked to the bathroom, and then I actually walked this morning for about 20 minutes also.
Okay, and that was pain-free.
Yeah.
Beautiful. I know, like one of the tests we were doing to aggravate your symptom was doing the lunges.
Yes.
So let's actually test it now.
Okay.
Okay? So we'll have you doing lunges, and you tell me if you feel pain. And we're gonna do 10, okay?
Okay.
And initially it was like very, like you will feel like a little bit unstable when you did it. So how that feel? Definitely look much better.
Feels great.
Yeah, your posture is really look nice. Okay.
No.
So part of the treatment, because that's one of the common questions that people ask, oh yeah, you just do the release only. No, we work on the posture, the body mechanic. We try to eliminate the trigger of the problem, which in this case was like bad anatomy, so I had to correct the arch because that was putting pressure on your ankle, and also there's some body mechanic like walking the right way, you know.
That's 21, just so you know.
That's perfect. That's awesome. Any pain, any discomfort?
No, none.
So what is your feedback about the ASTR treatment? Just 2 treatment for your ankle.
It's amazing, and I'm telling everyone, and you should come and get this done and learn how to change your body so that you can live pain-free.
Awesome. Thank you so much.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.